Returning your call.
Yes, ma'am. I believe I called you the other day because I could be wrong. Did you reach out to us and you had information or you wanted to share something in regards to, I think it's your son's apartment and
I sent a letter.
vacating
I
his
sent the
unit?
email. I did.
Okay. And I just wanted to follow up and see if there was, anything that you had questions about or that I needed to assist with in any way, shape, or form.
Well, did anybody get the email?
They may have, I may not have been shared the email. I was just asked to reach out to you.
From who?
From my director, Troy McLean.
Yes, I do. I do have a lot to say. So, are
Okay.
you ready?
Yes, ma'am.
Okay. So, first, I would like to ask: are you like a part of ACT Teams, Caroline? Like, do you work on their behalf?
Oh, no, 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 no. We're the MCO. So we're just the managed care organization. So we're not a provider agency.
Okay, so I'm able to file a complaint against them.
Oh, yes, yes, absolutely you can. And I can get you the specific number that you call to file a grievance.
No, that's what I did the email for. That's what I'm saying. I did the email, and now you said somebody they must have got it. That's why they want you to talk to me.
Oh, okay, okay. All right. So I'm sorry, I didn't know. Okay, so you've
Well,
already
why
done
would
that.
they not give you the email? That's crazy.
Yeah, they just asked me to call you, and I was like, oh, okay, I'll reach out.
Okay, all right. So we got that straight. I understand. All right. So let me give you a background.
Yes,
Okay,
ma'am.
so I'm sure you're aware that since you um or the Medicaid that you have all of my son's mental health documents from hospitals and
Yes,
everything.
ma'am.
Anything that Medicaid pays for, right?
Yes,
Okay.
we get a lot of those documents. Yes, ma'am.
Okay.
We have
So
access to them.
okay. So I am filing in it. It's all in the letter. So that's why he wants you to probably talk to me verbally. I'm filing a complaint against Carolina Outreach Act Team,
Mm-hmm.
specifically Crystal Faison, Stewart, China, Dr. Worringham, and Susan. Okay. I don't know how much
Okay.
of this you're writing down, but it's the Carolina Act Team for
Mm-hmm.
Medicaid fraud, neglect, abuse, and violation of rights. I mean, that's why I wrote a whole letter. So it's crazy I have to talk about this verbally. So I'm trying to remember stuff.
Yeah.
Um, the other one is your not the overall like the MCO, but the TCL program.
Right.
Filing a complaint against them.
Okay.
Um, I'm filing a complaint against Wake Med on New Bern, Holly
Uh-huh.
Hill, in Rutherford, North Carolina, Rutherford Hospital in Rutherford 10, North Carolina. Are you
Yeah,
writing
I
it?
know.
Okay.
I'm writing. I was
Okay.
just trying to make sure I capture everything that you're telling me. I'm sorry.
Okay, let me know when I need to proceed. I'm sorry.
Oh, yeah. No, you can go ahead now.
Rutherford. Okay, so let me say that I am his mother, his advocate. Um, after all this, I am going to start my own nonprofit to advocate for mental health rights. I am his healthcare power of attorney, and so I feel that I am not respected, and I have a healthcare power of attorney. So, starting
Hey,
with
do you
Carolina,
have documentation of that?
mm-hmm,
Because when I was looking, I did. Okay. All right.
it's just me and her.
Okay.
So, um, I don't know if you're aware that my son is in jail.
I did know that.
You did? Okay.
Yes. And I think he has a court date. It's like March 8th or 9th.
Yeah, because he has to have surgery on the first. And you got more information than me. How did you get more info? Because last I known, it was he had a court date on the first. But then I got a call from because they use my number at the jail, so they respect me somewhat, but they won't talk to me verbally. I have to talk to his lawyer, his pro bono. I'm not his pro bono, his public health.
Uh-huh.
That he's having surgery. So I didn't know that until Duke Ortho called me, and I found
Yes.
out. I didn't know my son almost died. I want that very well documented
Okay.
until I spoke to the detective and he gave me what happened.
See, and I didn't know that either. Seems
Okay.
like a lot of bits and pieces are getting missed somehow. Like I'm learning more stuff from you than I've learned from anyone else.
Okay. So my son almost died by the hands of Crystal Faison.
Okay.
So I want her fired, and I want Carolina Outreach under investigation immediately, the whole ACT team, because they felt my son, they, like I said, they neglected him, abused him, violation of rights, and Medicaid fraud. Now, the reason why I say that is because speaking with the detective, the little bit he told me, you can't tell everything, but he told me enough, like, to help me help my son,
Yeah.
that um Crystal should not have went into my son's apartment alone to make
Uh-huh.
him clean that apartment. Somebody ordered them to go in my son's home to clean that apartment. My son never let them in his house. Um, Maybe in the beginning, like 2018, when he was well, he probably did because he's been with them since 2018. But since COVID, they have not been in his house. The last time,
Oh.
the last time they would, because he didn't need the lemon. He would tell them, he would talk to them through the door. They probably have 5 minute conversation. That's what I'm saying is Medicaid fraud, because they told a detective that they go in his house twice a week to clean.
Oh.
So if you do that, the detectives have their pictures, I'm sure, because it was a crime scene, blood all over the place because she almost killed my son. I want her fired, and my son can't speak up for himself, but I want her brought up on charges. She played victim. Stewart called me that night on the 15th telling me he almost killed her, but she almost killed him. They are the
Oh.
only two people in that house. Crystal
Right.
is not a victim. My son is African American. She's Caucasian. She's a medical professional. My son is a whole lot to it. My son has mental health problems. He just got out Holly Hill on, he was admitted 117. He got out 124. That's 7 days. That's not enough
Mm-hmm.
to do anything. So that's why I want Holly Hill under investigation. I want Rutherford. He was in Rutherford in October. They only kept him for 7 days. Brought him back home. Wake Med turned him around twice. Turned him away twice when he asked for asylum, and Susan can testify to that because we had a very, very good relationship, working relationship on behalf of my son. I was part of their team until this happened. I
Right.
would speak to all of them, and I have documents of everything, emails, texts, whatever. So I have all that proof to help my son. My son, according to Holly Hill, on because I was able to enter his apartment and I was blown away that my son almost died. So I know my son is traumatized, but he don't even know what's wrong because when I went to visit him yesterday, he was like
Uh-huh.
a 5-year-old kid. He was back to himself because the jail has put him back on meds. Okay? He was not on
Yes.
meds. So
Oh.
Crystal almost killed him because he has this is per the Holly Hill on 124 discharge. Reason for admission, psychosis, homelessness. And he's not even homeless. Who said he was
Uh-huh.
homeless?
Yeah, because he had an apartment.
Discharge diagnosis, schizophrenia, disorganized, medical, constipation, meaning my son was starving to death. Dr. Warringham knew he was 140
Oh.
because Dr. Warringham called me because um, I can't give you, I dated everything in the letter. I can't give you all the dates without having to go back and pull
Oh, it's
everything
okay.
up. I'm just giving you a summary.
Yes,
Dr.
ma'am.
Warringham called me because I think it was November or October. Yeah, I think it was
Mm-hmm.
October before he went to Rutherford. And let me say, my son always advocated for himself. My son know
Mm-hmm.
he's fighting demons. He knows it's schizophrenia. The good side of my son is fighting that demon, and he sat up there and went to all these hospitals, and they didn't help him. So that's why they're all under investigation because he could have died because of neglect from all of them. So, um, are you there?
Yes, ma'am.
My
Yes, ma'am.
phone, I have to get a new phone. It's freezing and everything. So yeah, so my son knew how to advocate. He would always call 911,
Uh-huh.
and they would, if they would keep him, but if it wasn't serious enough, okay. So Susan said that they would, the only way they could keep him is if he's a harm to himself or others. Well, now look, he almost
Right.
died. Okay. So the
Yeah.
hospital failed. They didn't keep him. They didn't think he was deemed at that time a harm to himself or others. He was suicidal per Rutherford. They gave him discharge papers that I have, and you can always get it from them, that
Uh-huh.
he was suicidal back then. Um, but here in Holly Hill, he was schizophrenia. So it's like they don't care anymore about. But this is my son, and I'm an advocate for him.
Yes.
So yeah. So everybody felt him. So he almost died. But the thing is, the ACT team said that they went to his house to clean twice a week, and there's cobwebs. There's no food in the fridge. There's trash all over. So if she went on the 25th in that house by herself while he was still under psychosis, because there's no way you could be well that quick, just because Holly Hill discharged him don't mean you well.
Right.
So and then there was bottles everywhere, because I went in with my friend who also has mental health background. She worked for mental health hospitals, she worked for psychiatry and
Uh-huh.
everything. So I have witnesses that was, so my son had money, but he could not help himself. He was going to the bank like crazy, just piling up money. He would get Grubhub, but since he didn't have no phone no more, he had no way to get Grubhub.
Mm.
He used to go to McDonald's because he lives his apartment. You know his apartment because it's on the TCL. So, and then he would walk to Food Lion
Uh-huh.
sometimes, because all the actor kept saying was, well, he has to start learning how to do stuff himself. So they
Oh, so
you
they weren't assisting him with grocery shopping or any
I
of that?
used to. I used to in the beginning, 2018, 2019, 2020, when my son said he wanted his own money and didn't want me, like, to hold on to it because he wanted to do what he wanted to do with it.
Uh-huh.
The money started going to him. Okay. And from then on, I said, well, then let the ACT team help you more. I said,
Uh-huh.
let them, you ask the ACT team. But he was well back then. He was well. He was
Yeah.
not like he is now, almost ready to kill himself and all that stuff, and due to psychosis. So,
Uh-huh.
um, so he was doing that. So I called the ACT team and said, could y'all take him more? Because no, they wasn't taking him at first. They would just drop by, and they said that if he doesn't ask for help, there's nothing they can help him with. So I asked her, I said, well, could you take her? So I think at the beginning of 2021, they used to, Crystal did actually, to
Uh-huh.
Walmart, and he would get groceries. But then it
Uh-huh.
got to a point somewhere, something happened between 2022 where he didn't want nobody's help no more.
Oh.
Not even mine. The
Oh.
only time I was able to clean his apartment was when he had his inspection in July, and the ACT team, I mean, the Alliance came out there, and I was present that day, and he passed.
Yeah.
His house was clean as a whistle.
Uh-huh.
I took 6 hours to clean.
Oh my.
So, well, after that, I know something about the Alliance team said something, the TCL said, because Crystal referred it to me when we were on good speaking terms, that she has to enter his apartment once a month.
Uh-huh.
So apparently he hasn't been letting them until this time. Excuse me. I need something to drink. Until now. Why all of a
Uh-huh.
sudden February 15th you are adamant? And number two, if y'all saw his apartment that trash, why did she go by herself? Why wasn't there a team? Why didn't Stewart go?
Uh-huh.
So that's the gist of it. So he's in he's in the jail on 60,000 bond. Who's to say under psychosis he knew what he was doing?
Right. Right. And
And
sounds like
according
he
to,
might not have been medicated as well.
no, he wasn't, because you need to somebody needs to get the blood work from Holly Hill.
Right.
But I saw the actual pills. I saw his psychosis pills recently. They
Uh-huh.
just drop it off. That's all they just. And that's another thing. They say they can't make him take his meds, but they can make him clean his apartment. Now you think somebody under psychosis, because it didn't go away after 7 days, I'm sure,
Uh-huh.
that you gonna tell me to clean my apartment and I'm not well? Obviously I don't care about life right now. But he wanted
Uh-huh.
to live. That's why he kept going to the hospital. So like I said, he was fighting his demons, but going in to make him clean is the last thing should have been on their mind. They should have been making sure he was medicated properly.
Mhm.
So, and also my son did try to fire them. Susan, the nurse, gonna have to testify because we went to his apartment together because they couldn't find him. Every time he goes to the hospital, they can't find him because she told me that hospitals don't communicate with them until like discharge time. So sometimes they don't even be knowing, not until they go visit him to see if he's home. And she couldn't find him. It's all documented in the letter. Like I said, I can look it up, but I'm giving you a summary. But
Yeah.
everything is documented in that letter. But he went missing, according to them. He was in a hospital and they never knew.
And when they have those issues, like say they go to his house, he's missing, do they reach out to you to let you know, or?
He was missing on one occasion. He was missing since um oh man, see now I should have had my paperwork ready. But let me look on my calendar because I document everything.
Yes.
When my son gets sick, I document everything. I have even text messages where he would be cursing me out, talking out his head. Because I knew he
Okay.
was off his meds, so I didn't take it serious. But I would tell Crystal and them, and we all would tell each other we're worried about him.
Mhm.
But they didn't do nothing. So I can relate all I want, but I can't physically take my son to the hospital. But he took himself. So he should have
Right.
been in the hospital. And Dr. Warrenham almost was going to, when he saw he was 140, have him admitted. But he never did. So Dr. Warrenham, that's why I want him under investigation. But I'm looking at my calendar now, and I can give you a quick summary.
Okay.
But that's the gist of it. So she went in his house, made him clean, tried to make him clean up. Fight ensued, but she's claiming sexual assault. He has a mug shot online now. But now the things doctors, the detective told me, and me seeing his own apartment, that she shouldn't have been in there. Number one, she invaded his territory. So she probably made it seem that she had to go in, and he probably opened the door and finally let her. But whatever they was talking about, a fight ensued.
Oh.
But she's claiming he tried to sexually assault. He wasn't thinking about that. He used to have a girlfriend, so he don't need to be doing stuff like that. So let me see. I'm going back on my calendar to see where in this psychosis. And like I said, I tried several times to go in his house. Sometimes he would let me, sometimes he won't. But recently he wouldn't even let me. So I'm not going to force myself. I can't force myself to clean. That's his
Right.
property. And if Crystal was so worried and stuff, if he was going to lose, that mean he wasn't able to take care of it no more. So they should have found him a group home.
Right.
Find him somewhere else to live, but don't force him. Why are you so worried about his house versus his brain? So on October, this all started because he used to pay his bills on time without without any problems. He wanted to make sure he had cable and all that stuff. He used to have Xbox. He used to have a TV. He used to have a laptop. So why did he get rid of it? Was it because something told him in his head, like psychosis, to throw it all away? That expensive stuff? So, but when Susan went in the house that day, I'm sure she can attest to you that there was no TV or nothing. So, how was they in his house before? They never went in his house before. So in September, um, I took my son to the ER at 9 p.m. because he was calling me because he constantly have those problems because he's not getting enough liquids. And so I took him on the 18th because he called me at 9 o'clock saying he need to go. Um, for okay, and so in October was the last time, according to the former Chelsea Apartments. We used to work real well together. Um, Last she saw him with his girlfriend because she said they look cute together. So he tried to have his own life. He didn't need Crystal.
Right.
Um, October 22nd, October 7th, 2020, Keith said, don't talk to you no more. But they still did because they went under my healthcare power of attorney. So they went under that guise. But my son was under psychosis because I have text messages because, like I said, he talks to me via text more than talking because he don't really verbalize.
Yeah.
He's very limited in his verbalization. So, but he'll talk via text. So he was talking crazy to me one day, and I said, I'm gonna call the ACT team. Next thing you know, he called the ACT team and said, don't talk to me no more. But they still talk to me on emergency basis, not every day. But I also know by law that I can relay stuff to them. So about if I'm worried about him, because they would have to follow up on it. So I would be doing that. I would be the one calling and selling him groceries. He asked me, was it tainted? And I have that on recording because I was like, why is my son acting like this? I said, I don't know. So, I can't prove that he's on and off his meds because I don't live with him. You see what I'm saying?
Yeah.
But according to all those bottles that I retrieved, he hasn't been on his medication. So that was in October because I document everything on my calendar. So on this October 17th, no, that's nothing. Dr. Warringham called me the next day saying, because actually you all got the call. Chelsea Apartments called you because they didn't know what else to do and they didn't want to call the police, I guess, because it wasn't like verbal. I mean, it wasn't physical, it was just verbal. He was yelling at a neighbor at the top of his lungs.
Oh, and that was, you said October, November?
October 19th, 2022.
Okay.
And because Dr. Warren tells me the next day that obscenities and he was banging on the walls and stuff. So he was in there having a psychosis.
And so did the ACT team try to IVC him at that time when?
Dr. Warringham said, that's when I told you, he said, because when he did go visit him, I guess on the 20th or the 19th, he said that that's when he knows how small my son was. So Dr. Warringham saw that apartment.
Okay.
But he said that he's going to check on him because they don't work on weekends. So he said he's going to check on him in a couple of days. And if he's still the same, then he will. So he should have IVC'd him then. But he chose not to. So he should have saw his apartment, and he should have saw that he wasn't eating. He should have looked in his fridge. Like, they didn't do none of that. So on October 25th, and this is stuff that Susan would tell me later on, like I said, only when it was an emergency would they talk to me. But if I had something to say, I would call them anyway. So, due to him saying don't talk to me because he was in psychosis and he didn't want me like calling on him. And he did. He wants help, but his psychosis tells him don't get help. So anyway, he got himself to the ER. I think he always calls 911. They get him there. So the ER did keep him. She didn't tell me which one, but as soon as Wake Med. And then on the 28th of October, he was transferred to Rutherford. Let me know when to proceed.
Yeah, I'm sorry, I was typing. That's why I was quiet.
I know. I said, let me slow down.
What is Rutherford?
It's a hospital.
It's a hospital. Okay.
Mm-hmm. I mean, maybe it has a mental health component. I don't know if it's a whole mental. I think they work extensively with the mental health. Yeah.
Okay.
But he was shipped 3 hours away. But then they turned around and sent him back home via sheriff 7 days later. And I have those documentation. And the reason this time I'm able to tell the story because I document everything on my calendar. So they sent him back home with his haircut because my son used to have dreads. I have pictures of him with dreads. He came home with a haircut. So I don't know what happened in there.
Oh, goodness.
Actually, that day on October 2nd, to be exact, after, he was missing then. He was missing, according to them. They didn't find out he was in Rutherford until Dr. Warringham called me and said that's where he was. But they didn't know. Like when he goes into the ER, they don't be knowing.
Oh.
They don't know.
Right.
They find out later. I think because I was calling, I have to look back. I was trying to, I said I couldn't reach my son or something or whatever. And I think I inquired. Like I said, I can inquire. But all I know is finally Dr. Warringham called me and said he was in Rutherford, but he told me he would be discharged. No, he didn't know when he was going to be discharged. But all I know is as soon as I found out that he was in Rutherford, I ran to his apartment and started cleaning.
Oh, yeah.
I got it pretty much together. I have documentation of, I took pictures of when it was a mess, so I have the actual date via documentation of taking photos of the
Mm-hmm.
mess. But I cleaned it up, and he walks through the door
Oh.
on the second. He came home, and he just sat down and he was shaking his head, and I asked him, was he okay? He need anything to eat? He said he's okay. And I already had the apartment pretty much clean. So I was like, he's home? And he wouldn't tell
Right.
me. He wouldn't talk to me much. So, but he was shaking his head. He was holding his head like, because he came home with a shaved head. So I don't know what happened in there. But he came home, and then I made sure, I said, you okay? You need anything? He was like, no, no. And I could tell that he just wanted to be alone. So
Mm-hmm.
I left, but the house was already cleaned up to the best of my ability.
Right.
So that was October 2nd. I have it right here. MA home, came home from hospital with his shaved head, clean MA apartment. So let's see, I did that. Okay. Oh, I went the next day to finish cleaning. That's what happened. Because I saw
Mm-hmm.
he was like irritated just coming home. I came the very next day at 7 a.m. I went to wash all his clothes, and I brought him, I think that's when I brought him some food from the store. And I think that's when he told me that it was tainted.
Mm-hmm.
Um, I mean, I'm talking about packaged food from the grocery store. So yeah, so I tried in November. That ended up being the first. He came on November 2nd. I went back on the 3rd. So after I did all that, um, I'm figuring, like, he came home from the hospital. To my knowledge, I said, okay, well, the ACT team gonna follow up and do their job and check on him because I live 30 minutes away. So I felt I did what I needed to do. So I was like, I don't see him every day. So I knew that I could talk to him and call him and check on him. And if he needed me, he would call me, like he wanted me to go to the ER in September. But I wasn't out there for a few weeks, probably a month, because I thought I did my part. And like I said, I thought the acting will make sure he take his meds and
Mm-hmm.
do the rest of the stuff they supposed to have. That's their job. Because I basically was his caregiver, you know, but I was like, the act team need to do their job.
Right.
So I wasn't
Right.
running out to his house every day and going to the grocery store. I was like, let the act team do that. The act team would take him to get money orders for his rent. He made sure he paid his rent on time. And I don't know if I mentioned it, but when I saw him in the jail yesterday, he asked me to pay his rent.
For February or for like March coming up?
March. He paid February 1st.
Oh, okay. Okay. Yeah.
He's thinking he's coming back home.
Oh.
He's in there not knowing what's going on.
Mm-hmm.
He didn't understand the difference between a public defender and a real lawyer, because I said, do you want me to get you a lawyer? He's like, well, I got a lawyer. I said, no, that's a court lawyer. I was like, did you want one that you have to pay? So he don't understand that.
Right.
I didn't go in there and give no, I didn't want to know nothing about the case. I didn't want to hear his side of nothing because I don't want him saying nothing.
Mm-hmm.
Let
Right.
his lawyer do all that. I just wanted to make sure he was okay, because from the detective telling me he has significant injuries, the medic in the jail went and talked to me. So when I finally got to see him, I laid eyes on him. I was thanking God that he's alive, but his hand probably was almost chopped off.
Oh my gosh.
Say she called the ACT team in an ambulance. My son could have bled to death right there. Or what if she would have stabbed him at a place because he was already bleeding out?
Mm-hmm.
So she shouldn't be working right now. And so if there's nothing, um, if there's nothing done about that, I'm going higher than you all.
Mm-hmm.
Actually, I am. I'm already telling you this. I am. I'm calling everybody because my son was neglected, abused, violated of his rights because he fired him. And according to Holly Hill, he was supposed to have be discharged to Monarch. It didn't say nothing about no daggone Carolina outreach.
Mm-hmm.
So I don't know why the outreach act team needs to clean his apartment versus making sure he was steady first, stabilized. So
Mm-hmm.
some things Holly Springs says, what are some early warning signs? Isolation and clenching fits. So it says on here, what are some of your specific events to overwhelm you? Money and family. So the money is in his wallet, because
Mm-hmm.
why would you? He kept running to the bank, and that's dangerous. He could have
Right.
got robbed. walking to Food Line by himself under psychosis. He could have got hit by a car.
Mhm.
Um, it says, what is a specific plan you or someone else will follow in case of these things happen? Walk away. Crystal shouldn't even stepped in that apartment. Did she read this? Did she read this chart? No, because this went to Monarch. I don't think they even got this.
Is that a hospital discharge summary?
Yeah, he had it laying on his table. So I don't know what more else I could tell you that I just want her to investigate, and I do want somebody to come out to my son's apartment before I have to clean it out because I have the 10-day notice. But I need somebody from the state or you to come visit that apartment. All you gotta do is look at it for 5 minutes and see that a lot Crystal and all them lied to the detective.